I mean, it's your life. So of course it's important that you're living a life that is most authentic to your true self, to who you really are.
Well, you can come into therapy to treat anxiety or depression or a phobia or grief. You can also come to therapy for the purpose of like doing some soul searching or figuring out how to, be the happiest, best version of yourself.
To eat healthy or to go to the gym, even if you're not sick, just kind of a part of your overall wellness. Therapy is the same, and taking care of your emotional health is the same. An essential component to taking care of your health, just as much as you take care of your bodily health, you take care of your emotional health.
It leaves you feeling better able to navigate your life. So you feel more equipped to deal with like life's curveballs and stressors and your relationships. And
the range can be from somebody in crisis or somebody who's been suffering for years and years with very chronic mental health problems, to somebody who's just coming in to get to know themselves better or to become more in touch with themselves.
I would say in general, therapy is really kind of about creating a space for you to reflect on yourself, reflect on your life.
Dealing with the stigma of coming in for therapy. If I come to therapy, does that mean I'm weak? Why can't I handle this myself? I should just be able to handle this myself. Okay, I'm just gonna handle it myself and I'm not gonna go to therapy, because if I don't go to therapy, then that means I don't really have a problem. I'm not really depressed. I don't really have anxiety. I don't really have problems in my life as long as I don't go to therapy and admit it and say it out loud. But that doesn't mean that they don't exist or that they go away. They're there and they're getting to have a hold on your life.
What research tells us is that what makes therapy work is the rapport that you have with a client. And so that is really why finding the right fit between yourself and a therapist is so essential.
Because we are a multidisciplinary team, we are able to meet all of the needs of our patients.
We have a really good team of professionals here who are very diversified in their training, in their education, their background, and their areas of expertise. So we feel very confident in our ability to meet each client's unique needs.
I think when somebody is contemplating making that first call, taking that step towards starting therapy, the fact that they're contemplating it and thinking about it is kind of their subconscious nagging at them saying, hey, we get kind of one time shot at this thing called life, and we want to make sure that we are living the best possible version of that. We don't get a dress rehearsal, so to speak.